really focusing on researching the molecular pathways that are involved in the behavioral disturbances that are so common in Alzheimer's disease, and really pushing for new treatments that really get at the biology instead of using the drugs that are really indicated for other conditions. I think it's super important to understand that.
And then there's another hint. It's funny, everybody probably has a different view of what caught their attention. As a physician, I noticed that she was taking an inhaler at the bedside with the help of her husband. So patients who have dementia also have other illnesses that need to be managed, and these can be very complicated because she may not want to take her risperidone for her Alzheimer's and management of that disease, but how do you convince to take your blood pressure pill or your inhaler? And these are constant struggles. So, that's where as geriatricians, and I want to just give a little humble plug to Dr. Wolf Klein, who's nationally and internationally recognized in the roles of geriatric medicine and management of patients with dementia in our practice. And she's well published, and I'm actually under acknowledging you, but but these patients are very, very challenging to manage comprehensively, and you can take pieces of their care, but it really needs to take a holistic approach. And the safety issue is another thing that I noticed, that safety is predominant problem where safety is foremost, how to manage individuals so they don't harm themselves or anybody around them.
So while we're under acknowledging people, and going back to your point, I like very much what you said about the holistic thing. And I think this is really an approach that you see at the CATS, and we are very fortunate to have outstanding colleagues. I mean, it's probably not, I don't know what it is, Jeremy, you'll tell me every 4 weeks I'm referring to somebody to you. As a matter of fact, I'm hounding him because he'll give me something like, yeah, I have an opening in 2 months. I'm like, no, let's get it real. How about tomorrow afternoon? And after 4 phone calls, finally he'll see the patient. So let's over-acknowledge our colleagues, and I really want to expand on something that I saw in the movie, and we're all, again, as Maria was saying, we're all seeing different things. I want to acknowledge the role of our interdisciplinary team, geriatric team. So you were asking this question, but I want to really make it very clear that one of the things that makes our approach so unique is that we're talking about a multiplicity of physicians working extremely closely with our colleague in geropsychiatry. Again, we're blessed to have the #1 geropsychiatry program in the country, without a doubt. I mean, and that's not new, it just keeps growing. I mean, it's amazing what you guys have been doing. And I'm the oldest here, so I can say that I know this since 1976, okay? I mean, you're a baby, but it's amazing what these guys have accomplished. So we work very closely to them. And we work with them, but we also work with our colleagues from everywhere. So we have in our geriatric faculty practice, where Dr. Carney and I work together, we have geriatric nurses who've worked with us forever, because these patients will have nursing issues, feeding issues, urinary incontinence, fecal incontinence issue. And we work with our colleagues, social workers. We have extraordinary social workers. And I will say that part of our team is every one of you, because we work extremely closely with the patients, the caregivers, the family members. So we started talking about, and that's so interesting to hear what Luke said. You had this question about what actually prompted you to bring your mom. You knew something was off, but you didn't really get to the doctors for probably years after you had noticed. And we hear this all the time, by the way. When the patients come to us, I mean, I have patients who come to me for the first time with advanced dementia because of one incident. Often it'll be an elopement. They're found somewhere in Grand Central Parkway. So they come to me and the family will say, yeah, we've known all along, but we're okay until that event. So in your case, it was just one too many car accidents. So I would say that all of us have the responsibility to take a look at our loved one cars. And when you see your loved one cars having yet one more fender bender, scraper, side view mirror pulled out, it's time to really rethink. One of the things we teach our geriatric fellow, around the geriatric fellowship program for North Shore-LIJ Health Systems is, ask the family member, would you put your kids in grandma's car? And if the answer is, of course not, then why do you really allow grandma to still drive? Because she will kill somebody on the road. I'm going to pass the microphone to my colleagues, but I just want to say one more thing, because I think we started talking about it, I think Jeremy, you started with this, but we have to keep in mind that one of the things that's so touching about this movie is that your mom is very young. But let's keep in mind that the 61 is just borderline very young. My youngest early Alzheimer was 34. And I will tell you that when that 34-year-old patient was admitted to Marian Jewish a few years ago, where, by the way, his mother and his grandmother had died at the age of 45. We had the biopsies of these, right? You know the patient I'm talking about. When that 34 was admitted for a totally unrelated problem, because as Dr. Carney was just saying, they can have asthma like everybody else. In this case, he had an acute gallbladder attack, and he required surgery. And he was admitted to the emergency room like all of us would if we had, some vomiting and right upper quadrant pain and so on and so forth. And his lovely, lovely wife, who at the time must have been, I don't know what she was, 30 something, she explained to the nurse in the emergency room that he seemed to be quite agitated because he had Alzheimer's. And the nurse says, come on, get serious. What kind of drug has he? Did he overdose or something? Is he doing drugs? And she says, no, he's agitated, not because of drugs, he has Alzheimer's. And they just couldn't fathom what the story was. And of course, I knew exactly what to do about this. I just called Dr. Coppell, said, you deal with it, So this is how we work. This way, I know I'm a great doctor. I really know what to do in this condition. And we work extremely closely, because we had the right surgeon dealing with this. You were dealing with the behavioral issue. We were dealing with everything. And I will tell you that the social worker did an extraordinary job with the wife and with the 2 young children.
Luke, I just wanted to ask you a quick question. I know that you are a psychiatrist, for those of you who haven't read the program yet. Did the experience that you had, not only with the making of this film, but seeing what was going on with your grandmother, your mother, influence either your decision to go into that field, or did you always think that you wanted to go into medicine? Did this enhance that, did this affect that in any way?
I would say, if anything, in my family experience, made me want to pursue mental health as a career would be my mom. She was this beloved therapist in the school where I worked. And I had sort of already headed down that road when she was diagnosed. I was in medical school when she was first diagnosed with mild cognitive impairment, which was scary because I was sort of like just learning about what that meant. In terms of the likelihood of progression to dementia. And then she was diagnosed with Alzheimer's right after I matched for my residency. So I had sort of already decided I wanted to pursue psychiatry not before my grandmother's illness, but I wouldn't say that pushed me in that direction.
How many times have you seen the film?
I've seen the finished version probably 8 or 9, 10 times.
I can't imagine it gets any easier to watch. How is it to watch your family, especially here you're in a room full of 100 or so people, kind of sharing your families, watching your home movie, an elaborate home movie at that, but and sharing such personal moments.
Yeah, well, the first time, so I've actually used some excerpts of the film to teach a course to neurology medical students, medical students on their neurology rotation. Just sort of trying to, as some of the doctors here have alluded to, trying to give them a sense of what is sort of the human side of the illness, what kind of things they should be thinking about and asking about beyond just what they can read in the textbook or what presents itself right in front of them. in an interview with a patient. So the first time I showed anybody any of this was, to the neurology clerkship director and a mentor of mine who's a psychotherapist, and I was terrified. I was terrified of what they would think of what we were showing and what we were exposing. It's hard to watch yourself on film too when you're not, you didn't set out to be an actor, or you're not trying to be anything. It's just a part of your life. But again, I think that the message that the movie conveys about this illness and about who my mom was and who my grandmother was, and I said was, look at that. Who she was and who she is and who she's becoming, it's real. It's a very powerful film for me to watch every time, because it does capture so much of what I feel like the experience has really been, and the kind of person my mother is. But because it's so true, I can't help but be proud of it, because I'm proud of her and proud of my family.
This is the third Gold Coast Film Festival, and pretty much at every screening I've been to, someone asks the same question, which I'm going to ask you now, which is, a lot of the films that we show, you're not going to see, in your multiplex, but they are so powerful in all different ways, depending on what kind of film they are. But they're all, beautiful pieces in and of themselves, that you want them to have a life beyond just this one screening. And I'm just curious if you know what the plan is for this film, beyond people like, everyone on the panel here, and I'm sure everybody here telling other people about it, like, you gotta find this film, but is there another plan for the film? Is there an interest in the film to go beyond?
Sure. So, fortunately, it's been accepted to a lot of film festivals like this one, so it's still showing. We'll continue to show. It will have a limited theater release, so they've gotten funding to do that. It'll also be on primetime on PBS in 2014, which is fantastic news for us.
We'll make sure we let you all know so that you can watch it again and you can pass along that information to your friends.
And another piece of it is that, and I'm hoping to partner with my brother doing this, but they want, my brother and his wife, the producer, want to make educational short films with the footage that they have, with interviews with professionals, still in the formative stages, but there's a lot to be learned about this disease, and we hope to make more.
You had a question?
Yeah, so I wanted to jump on the initial statement, which was there's this epidemic, there's this tsunami. And what do you think accounts for it? Is it people are older? Is it genetic? Is it chemicals and toxins that we live with? Or is it just being diagnosed better? Or is it the gene pool that, it could be all. What do you think?
Well, it's all excellent news. We are living longer. I don't consider myself particularly old. I trained at Long Island Jewish. I started my residency in '76, and when I did my fellowship at that time, so we're talking 25, 30 years ago, the percentage of people over the age of 65 was 8%. We've literally doubled this in the last 30 years. We know that the incidence of dementia, according to many articles, is anywhere between 30 to 50% after the age of 85. A very frightening number. I can tell you on an anecdotal basis that when I started practicing geriatric medicine, particularly in the outpatient, my average age of my patients was about 65, 70, 72. 75 I considered extremely old. I do not see 70 years old in my practice right now. My practice is primarily nonagenarians, 90 years old, with a couple of preemies, I refer to them, in their 80s. And I'm not particularly interested in 80 years old. They're not challenging enough. I like a good 90 years old. But that is basically most of my practice. You probably have the same experience.
My practice is a little bit different. I speak Spanish, Longevity and life expectancy is different in different age populations. In general, our life expectancy, if you were born in 1900, you were expected to live to the age of 45. If you're born in 2000, you're now expected to live into your mid-80s. But if you're a black male, that's lower, that's about 68. If you're a white female, you're expected to live into your mid-80s. So there is a health disparity between races and ethnicities. So my population, and I'm interested in promoting longevity, so I have some very healthy, independent seniors who we're trying to keep that way active. I also see patients who speak different languages, Spanish, as I said earlier. So I have a little bit younger population, I would say. But in general, the division of geriatric medicine and palliative medicine in the outpatient practice, we start seeing individuals who have functional impairments. So it could be cognitive or mental abilities are decreasing, or they have arthritis and their mobility is a little bit different. So that's when people start coming to us, when there's functional impairments of some sort.
The original question was about diagnosis and about why does it seem that there's this tsunami of this epidemic of people being diagnosed with Alzheimer's disease. I think one of the reasons, if you talk to people of a previous generation, they'll tell you that there was a grandparent that they thought was off or had senility, and they kind of, in terms of making a diagnosis of dementia, probably the most common question I get in the clinic, and I'm sure that my colleagues will kind of echo the sentiment, is what's the difference between dementia and Alzheimer's disease? And the patients, the families always ask, oh, this isn't Alzheimer's, it's dementia. And they'll look at me like, right? And so dementia is a syndrome that can have a lot of causes, and the most common cause is Alzheimer's disease, which is a particular protein pathology in the brain. But I think that it's kind of important to note that what really happened was, with the advent of some treatments that have proven to be modest at best and heralded as much more than they turned out to be, but some of the drugs that are currently on the market that have an indication for Alzheimer's disease, that really pushed a lot of people to make a formal diagnosis, because the feeling was there are medications on the market, at least there's something to do. Before there were any treatments, I think it was much more common just to regard senility, which, senile dementia, of course, just as dementia that happens with older age, the most common cause of that is Alzheimer's disease. But as treatments began to appear on the market, I think people began to be more interested in making a formal diagnosis. And I hope that with with the advent of treatments that actually target the pathology and are disease modifying, that's really when we need to make the diagnosis. Making the diagnosis now is important for families, it's important to give a prognosis, it's important to educate people, but the real importance is, when we have a treatment, when we have a prevention, that's when it's going to be really critical to make an early diagnosis.
Yes, you have a question?
Go.
Let's say we get somebody in our office, the family often bringing them in, complaining that there may be some memory loss, they want to get evaluated. For us medically, we would first do a diagnosis